Hi, everyone. Welcome to Tuesdays with Terica. I'm Terica Talbert. Hey, today we have wonderful conversation with Miss Tiffany James. She is a therapist with Benay's Creative Counseling from Richmond, Virginia. Yay! Hey, Miss Tiffany, how are you?
Hi, Terica. How are you? Such a pleasure to be here.
Oh, I am so thankful that you're able to be here. Okay, guys, we're doing this Zoom, okay? So we're doing something different. I told you we were going to be doing something different, and I told you we were going to be digging a little deeper. So I hope you guys come and go along with us, okay? All right, Miss Tiffany. So, how is everything in Richmond?
It's cold. How's everything down there?
It's a little cool here today too, but the sun is shining, so that's what makes the difference.
Yes.
So I know that we you have so graciously agreed to talk with us about mental health, and I know that you serve on various platforms. But just as we're getting started, can you share with our viewers what is counseling? What is having a therapist versus having a psychiatrist? Can you kind of shed some light on a little bit of that?
Yes. Um, Excellent question. I I often ask my clients, so what do you think the difference is coming to a therapist versus your mom, your dad, your best friend? You seek counsel from anybody and everybody that you find that's in close in your circle that you trust, and they give different reasons. And I say, well, the difference between a therapist and your friends, your family, is that a therapist does not tell you what to do. A therapist doesn't give
Mm,
you their opinion of what you should do, and versus your family who knows you and thinks that you should have the best, they give you more of what they think you should do, their opinion of what you should do, versus you working through your own things and coming up with your own decisions
mhm.
of what you want to do. For example, people can tell you all day long that you need to change, but until you decide that you need to change, it doesn't make a difference. So that's the difference in that piece. Now, with the psychiatrist, they're the medication pushers. They're
Okay.
the ones that are going to give you a medication. You'll see them for about 15 minutes. If you go for an evaluation, it can be up to an hour. And so they're the ones that kind of help you with regulating your medication.
Okay.
A psychologist, they do more of the testing. So they do a lot of assessments and testing for different mental health. So that's good for people to know the difference. A therapist is there for you, works for you for an hour, between anywhere between 30 minutes to an hour. So you get that time with them. And it should work out once a week as needed, or maybe if you need it less or you're progressing, then you can do it twice a week. I mean, so I'm sorry, twice a month. But the difference is that therapists are there to work with you and help you through,
Mhm.
and they actually should align with the psychiatrist or with any other your doctors so that they can actually give them what they see and what they evaluate in you, because they spend a lot more time with you than other doctors and psychiatrists do.
And I get that. So what I'm hearing, and please correct me if I'm wrong, you really help a person talk the situation through without really kind of being opinionated about it, but
Absolutely.
really just talk it through, get it out, and allow them see their words in motion, so to speak. So
Absolutely.
okay,
Absolutely.
okay.
So we do rephrasing and reflecting.
Mm-hmm.
And when we say, well, I hear you say, or what I'm hearing you say, then you're like, well, no, that's not what I'm really saying. Or is that what I'm really saying? And then they're able to actually process it. Just like you say, it comes to life for them.
Mm-hmm.
It's different when other people say it to you than when you actually say it for yourself.
Wow, so this is a question that I have like down my list, but I'm gonna throw it in right now. Does everybody need a therapist, in your opinion?
I'm sorry, we lost each other.
Okay, I'm sorry. I was
The
just saying,
connection went out.
it was a later question, but I'm throwing it out there now.
Yeah.
In your opinion, does everybody need a therapist? Do
Oh,
you, would you
absolutely.
say?
Yes. And everyone, every adult. needs to go in and process their childhood,
Mm-hmm.
process traumas, process changes that have occurred in their life that makes them who they are today.
Mm-hmm.
We're not born and then we just become. When you're born, you become your environment, behaviors are learned. There's a lot of inherited things that go along with that. So it's good to know who you are and then even who you want to be, because we can make those changes and decide what and who we want to be.
I think that is so wonderful. And I did mention to my audience on last week that you were going to be joining us, and that I did want you to piggyback off of some of the things that I discussed last week about my own childhood. But at the end of the day, Tim and I, we were kind of talking and going over some things, and I really felt very emotional about, I thought I was over over everything, but I realized that I was heavy, a little sad, um, but it would have been good to have a therapist. It would have been good to have a Tiffany. But I'm so grateful that you're a part of my life now, so thank you for all that you do for me and my family. So is it difficult to encourage someone that they are actually in need of counseling or in need of a therapist?
Goes right back to what I say about you can go to your friends and ask them things. They're going to give you their opinion, but unless you decide that that's what you want to do, it's very difficult to have someone say, you need to go to a therapist. You We have a stigma that mental health is bad. So with
Right.
that, when someone says, "Oh, you need to go talk to someone," or "You need a therapist," they feel like they're bad. They feel like there's something wrong with them, and so they are defensive and not ready to open up.
Mm-hmm.
And unfortunately, that's when most people do see a therapist, is when they're at their end, when there's nothing, when they don't know what else to do, and they feel like they're just losing everything. And then that's when they come in and really have to work hard to just get out the hole that they're in.
Yeah.
That's why it's important for everyone to just at least once in their life just go talk to a professional and just see what kind of hidden things that they have this in their life and in their emotions and feelings that they have in their subconscious that they don't even realize is there, that actually affects their everyday being.
So is it harder for you as a therapist to pick someone up from the floor, or is it better or easier in your profession to kind of guide someone when they're already at a place? Um, in my mind, when you're having to start from ground floor, it's always more difficult because there's more issues that have never been addressed versus a person that has at least had a thought about something and kind of knows something may be going on, but maybe not in the mind frame to act on it immediately. So, what are your thoughts on that? Is that a question or no?
Yes, it is a question. Um, is it difficult when you're feeling rock bottom and there's no way out? Is it difficult when you're in this black hole that has gotten so dark and so deep that you don't know what to do? Yes, it is difficult. Is it difficult when you come in thinking that you're fine and you're over things from your past and you've worked through things and you're doing good, and then you find that trigger or find that there's something still there? Is it hard? Yes. So to answer both, yes, it is hard whether you are deep, deep in something or whether you think that you have done really well and you just want to bring it up. It's up to the individual. I always tell my clients, I am here for you. I'm on your team, but I'm not going to work harder than you do, because therapy is work.
Mm.
Therapy is work. Therapy is not something, I tell them, some days you'll feel better leaving and some days you won't, because you really dig deep into who you are, traumas, things that you don't want to remember, things that you don't want to resurface, feelings and emotions that you have suppressed, that
Mhm.
people think that, oh, I just cover it up. Oh, I don't think about it anymore. Those feelings and emotions don't go anywhere. So
Right.
then when a trigger comes or when you've gone through so many stressors, that's when they come up in explosions, outbursts, anger, impulsive behaviors that can get people in trouble. So
Mhm.
it's important to work through our emotions and feelings every day.
That's kind of one of the things that I was saying last week is that I felt like I was carrying a corpse, but I didn't know what it was. But that you're absolutely right, absolutely right. So what does it look like when someone finally agrees to come and speak with you? Like, what is your initial evaluation, or do you just have a conversation to get started? What does that look like?
I usually ask them their background, if they've ever had therapy before, and then I ask, "What has brought you here?" And so then that starts the conversation. Sometimes they don't really know what direction to go to, so they may say, "Well, I'm just feeling a certain kind of way."
Mhm.
So I don't know really how to process or what to really talk about, and then I start back to, "Well, when you were in your mother's womb, was she happy? Was she stressed?
Really?
Did
Where
she
that
go?"
begin?
Yes, and so they'll, like most people, they're like, "Well, I don't know," and then they'll think, "Well, she was a single mom. Yes, she had to stop working or whatever the case may be. Oh, yes, my dad wasn't very nice, or, she had to deal with different traumas." Those things are important. The foundation of it all is because when a mother is carrying a baby,
Yeah.
the stress is on the baby just like the stress is on the mother. So
Mm,
when that mother is feeling that tension and stress, her uterus is contracting. And as that embryo is trying to grow and develop, it's causing stress on it. So when that baby is born, that baby has stress already innated in their being. So if
wow.
it's, for example, if it's a home where it's domestic violence, when that baby hears that voice, that baby is already tense and is experiencing that anxiety. So then we start from there, giving kind of like a foundation. And from 0 to 5, 0 to 7, how was your life? And of course, they said, "Well, I really don't know. How do people tell you your life was? Do you remember pictures, things like that?" Those are the most important developmental years because that's actually what creates your character, your personality, and your resilience and who you are. So if you don't get the nourishment and the love and the things that babies need, toddlers need to develop, then there will be a deficiency, and then you're going to have some emotional and mental illnesses that come along with that.
So let me ask you this. I always have heard people say, I stayed in the home, well, women usually, I stayed in the home through a bad or difficult marriage for the kids. Is that a good thing? Or, because kind of what I'm hearing you say, then no, you need to still make sure that the environment for the child is reflecting on what you want them to perceive in life, correct?
Absolutely. Behaviors are learned. So if you're in a unhappy marriage, you're teaching your children that that's acceptable, that
Mm-hmm.
being unhappy is okay.
Mm-hmm.
If you're being in an abusive relationship, you're teaching your children that that's the correct behavior. That's what you're supposed to do. Even though they know they don't, that's what happens. And so you hear a lot of generational curses. Oh, that's generational. His mother did it, their mother did. But that's why, because behaviors are learned. That's how we learn. So that's what we become. So no, I don't encourage anyone who is in a marriage that they're unhappy with to stay for the sake of the children. One thing that I want everyone to know is that you are the most important person. Not your children, not your husband, but you are the most important person. And if you don't treat yourself like you're the most important person, then nobody else will. And if you're not taking care of yourself, you definitely can't take care of someone else.
I agree. I agree. I agree so full heartedly. So some of the challenges that you've experienced over time, as to you have someone that's coming in and they have their own, various situation or difficulties. Has there been one particular thing that you think overall people really have a struggle with? Would that be being able to identify with who they are? Would it be family situations? Would it be marital situations, career situations, is there one thing that you have seen over your years of experience that seems to be a greater challenge than another, or are all of them pretty much on an individual base?
All on an individual basis. Um, some women can handle something different than other women can.
Mm-hmm.
Some men can handle things in situations different than others. Again, it goes back to your childhood,
Wow. Yeah.
how you were raised, the behaviors that were learned. If you were taught early on how to communicate and how to have a difficult conversation, how to do conflict resolution, then you're a little stronger in that. But if you weren't taught that, then you fight or you flight or you freeze, and then you don't get your point across or able to express yourself. So it just depends on who you are. Can we all learn? Absolutely. Can we all do better? Absolutely. Once we learn where it comes from, process where it comes from, then we're able to change our mindset on how we think about things.
I want to piggyback off of what you said: flight, fright, or freeze. Can
Flight,
or
fight, or freeze.
fight? Okay, I thought you meant they out of there, but okay.
That's that's the flee. Fight,
Okay.
fight, or freeze. Mhm.
Okay, okay. So I know that you work with adolescent family situations, actually transgender. I see the need in that, but I never knew that there was a therapist for that. And I can understand for homosexuality. Is there anything on either of those that you would like to share?
So my specialty is cognitive behavior therapy, which is CBT, and that's basically changing the process of your thought pattern. We think the way we were raised to think, our environment over the years, what we have learned. And so when you go through so much trauma and change, not knowing who you are,
Mm-hmm.
having people not accept you, having people mistreat you, worrying about how you're going to fit in society and not even knowing who you are, it goes along with a lot of the other therapy issues and problems is changing your thought process, accepting who you are, learning who you are. You know, we are, again, the most important person to ourselves, but we're not taught that. So
Mm-hmm.
we're always taught to be kind to others, to worry about what other people think and feel. But it's important for us to dig deep to know what we love, we want, and we need, and act on that.
Mm-hmm.
And sometimes that comes with consequences, so it makes it very difficult.
Mm-hmm.
I um, I love working with those who feel like that they are isolated or that nobody cares and loves them, because again, it starts with us loving ourselves. And
Mm-hmm.
if you weren't taught to do that, then you don't know how to love anybody else.
Wow, that is so amazing. I'm often, sharing about my faith and my belief. But one of the things that I really want our viewers to know is that Miss James is here sharing about the clinical aspect, but she is also a supporter of the spiritual aspect of being fully sound minded as well. Would you like to piggyback off of that?
Yes, yes. Um, while I was in my graduate program to get my degree to be able to be a therapist, my faith base teaches you to pretty much judge. I mean, I just have to put it out there. You can't accept this, can't accept that. This is a sin, that is a sin, So I always had in the back of my mind, if we're supposed to love everybody, why are we not supposed to be among everyone to bring them to Christ?
Right.
How are we going to win souls if we have to separate ourselves all the time and judge others? So
Mm-hmm.
going through my master's program and learning that I had to work with all kinds of people and all backgrounds, all religions, it gave me appreciation that we're all human. We're all people. And it is not my job to judge you. It's my job to love you. And because I am a therapist that is a Christian, and I believe that God's greatest gift is love, I try to give that even in my therapy.
Hmm.
With that, I don't judge where you are, where you're going. I help you to get where it is. It's not my journey, it's your journey. So
Hmm.
whatever I can do to give you the tools to be successful and happy,
Hmm.
that's what I do. If Jesus comes in there a little bit, which I tell them all the time, I'm not a Christian counselor, but if they open the door and God gives me something, I definitely can give it back to them.
I think that's awesome. So, just so that you guys know, we are not projecting anything that you may or may not want as far as salvation. You know, I always tell you my faith and my belief. I believe that God is the answer to everything. However, I am not naive to believe that from the religious side that there isn't anything clinical or medical that can help while you are going through your process or your stages of mental health and how you need to recover. I believe in the system of we have doctors. God has given doctors knowledge and wisdom to be able to help us from a medical standpoint, but we trust Him to bring forth the completion of our healing. So I think it goes hand in hand. I don't want anyone to think that I'm trying to push one thing over another because I do see it from both sides, from a medical standpoint and from a Christian standpoint. But I think this is one of those times where we all need to come together for the good of the individual because everybody needs to be free and happy and feel like they're being heard in whatever state that they're in.
Yes.
Okay, so I'm gonna get off my horse right now. Okay, so let me ask you this. Since everybody was going through so much through COVID, because you know, COVID was kind of horrible. Well, not kind of horrible, it was really horrible. COVID was really horrible in the sense that it contained a lot of people to an environment where they really couldn't touch and hug and really communicate in the way that they normally would. Have you gotten a lot of clients that have had to go through that part and now they're trying to re-establish themselves back into an active community?
Absolutely. Absolutely. Um, I would say the children hurt the most, the young children, with the socialization of 2 years of losing that and not being able to develop during that time. However, a lot of people enjoyed after a while being home and did not want to return to the office. And I deal with a lot of clients like that. Oh, I don't want to be around people. We are here as humans to be a part of one another. We can't be here and not have relationships.
Mm-hmm.
So for you to isolate yourself and not want to be around anyone is a sign of sadness going into depression. When you isolate yourself and you don't want to socialize with other people and you don't want to do the things that you used to do that was fun, that's a sign that you may be suffering from depression. So during that time, you had a lot of people that were suffering from depression, not being able to get out and breathe and get some sunlight and talk to people and touch people because touching is very important as well. So yes, that was something that people are still coming out of and still trying to adjust to.
Mm-hmm. I hear people say all the time, "Yeah, I'm not really sure if I want to be around people anymore," and I think it's so sad because, like you said, we need each other. You know, during COVID, I was very fortunate that I was able to still be with my family, but I did have people that I knew that had to be isolated, whether they was in the hospital, someone had to go to the hospital and they had to go through the process of even losing someone in the hospital and they couldn't be there with them their last days, brought on depression, brought on a lot of emotional things and anger. And, you know, last week again, I would refer to a portion of my life when I was angry with the Lord and didn't even realize it. But people have been angry because they think that this is something that He did. And now they don't know what to do with the emotion behind all that. And I think because of, again, because of me working in a pillar of churches and so forth, different churches of people that I know, they haven't all gotten back to a place of being filled like they were, because now all of a sudden either the people don't want to come or they're angry about one thing or another. So we have to
I
be
agree.
mindful of that. We really have to be mindful of that, because it's one thing that we've had to go through it. It's one thing that we're here in this place. But now, how do we look forward to the future? How do you help us to look forward to the future if we are one of those ones that are still suffering?
Um, I do know of a few churches who still have not gone back into the
The
actual church for a congregation. Yes. And it is very difficult to do church, to do this, to do appointments and meetings when you're virtual. It helps that we can see each other.
Mhm.
But when you are not actually physically in a room with someone, touching and agreeing, actually being in a congregation of people, it can be very lonely. It
Yeah.
is very lonely. And for those who that's all they knew, because we teach, come to church, come to Bible study, be among your people, and then they don't have that anymore, then what happens to them? They lose faith. And when you lose faith and you lose hope, depressed, you have nothing to look forward to.
Mhm.
So, with that, we have to get back to having a desire for something, looking for
Ah.
something that we want
Mhm.
out of life, something that we want to enjoy out of life, feeling some gratitude in our life, appreciating the things that we do have. I teach mindfulness, being present right here with you, Terica, and sitting and feeling the environment and the air, and just knowing that I feel the warmth of the fire on my back, and just being present is something that we don't do. We move so much and we go through life so much that we never really take the time to smell the roses, as they used to say.
Mhm.
Just sit still and just be present with yourself. So if you're able to sit still and be present with yourself, then you're able to start changing your thought process from, I don't want to go out, I'm lonely, I'm sad, I'm depressed, to I'm grateful.
Mhm.
I have hope. I can go somewhere. I can do this. Let me make plans to do this. And I wanted to piggyback on something you were talking about, the church too, and how we're not trying to say, don't go to the church for your counsel. I encourage that. But a lot of times I have clients that have been with religious backgrounds that have been so hurt by the church because their parents and the congregation says, oh, pray about it.
Mhm.
Just pray about it. You don't need to talk to anybody. Pray about, oh, God's going to fix it. God's going to fix it. But if you don't have the mindset, and if you're going through something so bad that you don't have the mindset and don't know how to pray, how
Mhm.
are you going to pray? If you're feeling so low and down, how are you going to just articulate the words that you need to give? And just like you said, God blesses doctors to learn the science and technology and things that they need to help us. That's just not us in our mind. That's God giving us the ability to do certain things, how to build a house, how to build a fire, how to be a doctor. The same way for therapists too. We go to school, we train, but you will know when you have someone who that's their skill and that's their set. And that's where you go. You go to a professional when something's wrong, and that's what the same thing with your mental health. Your being is very important. And we need to just start learn to love ourselves and know that our mind is worth keeping and our spirit is worth living.
Absolutely. We're going to break and we're going to come back. Okay? So, you guys, we're going to have a part two. So, stay tuned. Miss Tiffany James, creative, Benay's Creative Counseling. Benay's Creative Counseling. Stay tuned.